What really attracted me to Baystate and kept me here was the feeling that when I came to work, I was coming to see family. So I wanted to be a physician since I was very young. I always thought I was going to go into family medicine or pediatrics, mostly because that's what I knew as a child growing up. When I first started my clinical years in medical school, my very first rotation was obstetrics and gynecology. I absolutely loved it. And then I thought, well, that's because it was my first clinical rotation and I was on the beach in Monmouth, New Jersey. And so I spent the rest of the year trying to decide if that was really OB-GYN, and I discovered that in fact it was the field that fascinated me. You're involved in people's lives at very interesting times. They're not always sick. Sometimes you have a chance to prevent illness and disease, and I've always been interested in the prevention side. I also love the balance of pregnant women and the fetus that they're carrying and how you balance the needs of each. On occasion, I've had patients where I delivered all of their children, and that was fun. The ones who I delivered right before I went into labor myself were also fun. But there are also those on whom I felt like I could make a difference. And often it really came down to we worked together to figure out what was going on with her, and there'd be a breakthrough and solve a problem that she had that really made a difference. I think every patient encounter, I learned something. I've been with women through the best of times, difficulty getting pregnant, finally get pregnant, giving birth, and the worst of times, a loss, finding out they have cancer. And so being able to help them weather the best and the worst and to share those with the patient and her family is very special.